here with Dr. Natsheh at Arceo Restaurant to talk about Avene's new skincare launch and anti-redness line. So Dr. Arceo just have a few simple questions. First, how does the new skincare Antirougeurs different from the original one that you had before?
Sure. So Avene is launching several new products that are different from the original line in the sense that the active ingredient is a little bit different. The new ingredient actually has something called saponins in them, which target two things with the blood vessel. One is to decrease the amount of congestion or sluggish blood flow, as well as decreasing the amount of new blood vessels that are being formed with rosacea.
Nice. And who would you say is the ideal candidate? Is it just rosacea patients, or would it be any kind of redness, any specific kind of redness?
Well, probably the people who will get the most benefit are people with rosacea, because they do have the most flushing, redness, or blushing. But anybody who has sensitive skin, for example, acne sufferers, people who have irritable skin, people who get eczema often, or winter dryness will also benefit from this product because of the soothing nature of the products as well as the anti-redness.
So would you say this is as good a hydrator as everything else, just made for a rosacea patient? Or?
That's a good way. That's a good way of looking at it. So it definitely has the hydration and moisturization properties, which are very important, and it has the added feature of having the active ingredient that helps decrease redness and decrease red blood flow.
And could you tell me about the ingredient in it, Rosacea extract?
Yes, Rosacea extract is essentially a plant that was found many years ago to have venotonic properties, meaning that it increases blood flow in certain areas and decreasing congestion. And the active ingredient is actually something called saponin, and that targets blood vessels in two different ways. It decreases the growth factor that makes new blood vessels, so we have less blood vessels being produced. And secondly, it decreases inflammation through another mechanism that helps decrease the total amount of redness. So you have decreased blood vessels and decreased inflammation, two of the key factors that happen with rosacea.
Nice. And can it be used equally by men and women?
Yes. Now, rosacea is known to be more common in women. For some reason, we're not exactly sure, but there are a lot of male sufferers. It's about 2 million Canadians who have rosacea. Slightly more women, but it can be used equally by men and women.
Nice. And then finally, I heard that the mask is really good for people post-laser. So can you tell me how that would work for someone who, say, goes in for maybe a minor laser therapy or some kind of, one of those afternoon procedures? How would it work for you?
Yeah, the mask is very good in the sense that it has a very cooling or calming or soothing property, especially when there's irritation. And for people with rosacea, one of the common procedures is laser, vascular laser, to decrease the amount of redness that they get. So this would be a great product for them because you're targeting, number one, the redness from the rosacea they have inherently, and secondly, you're protecting them from the damage that's done by the laser that they're doing to reduce the redness. So it's a great product for those people.
Nice. Thank you for your time.
Appreciate it.